Recovery time depends on what we do, but we talk about a bell-shaped curve of healing, and in that initial inflammatory curve, for the first 5 to 7 days, there's an increase in pain above what you've had prior to the injection. It's usually very well tolerated. We want you to move. We don't want you to lay in bed. We do give pain medicine as needed, but that's about a 5 to 7 day from up to down pain.
You start at about 50% of frequency, intensity, and time, and increase about 10% per week.
There's also a secondary phase in the first 2 weeks, but a lot of times it's not even noted by patients. It's very mild and very tolerable. I've also had many patients not take any pain medicine afterwards, and I was one of those. I had my back injected and I never took any pain medicine.
The recovery time actually kind of depends on the tissue or target organ that we're treating. So if it's a tendon or ligament, depending on how injured that tendon or ligament is, it can take anywhere from approximately 2 weeks to 3 months. For the joints and cartilage and the joint structures, they typically take longer, anywhere from 6 to 9 months for us to start to see good maturation. And then that collagen matures over a period of 9 months or a year. So as opposed to steroids, again, where we're trying to just block your body's response and knock it down for 3 months, we actually need to go grow tissue. So this is a totally different mindset. We need to get some growth factors in the stem cells there, have it recognize what's broken, have it start growing tissue. So it's going to take several months for those tissues to mature, but that really depends on the target organ that we're seeing. When we talk to patients and get their diagnostics on their x-rays and ultrasounds or MRIs, a lot of times we can give them a better idea on how damaged the tissue is, how long we think it'll actually take to get it to regenerate.
After my treatment, I would just go home and rest a little bit. The treatments give me a lot of energy. I always tell the nurses and the woman at the receptionist desk, I feel like going dancing. I really feel euphoric and positive. But then I do go home and rest. I don't work that day. And then the next day I'm fine.
I was initially completely off for about 8 weeks. We wanted to make sure everything had time to settle and go where it needed to go and start to do its job. Then I slowly started back into riding, and now I'm fully back in. I have no restrictions, and before I was only able to ride for about a half an hour before I had pain, and now I can ride 2, 3, 4 hours and still be pain-free.
There were days I could not walk. The pain was so bad. To stand up, to put your body weight on, it would drop me to the floor, literally. So painful. And by that day, there was no pain, but by the next day, there still was no pain after she did the stem cell treatment. And that went on for weeks. And then there was a normalization, which you're told about. And so you know that that can happen. Some people it does, some people it doesn't. That all went exactly as she had explained it to me. There was a normalizing period where there was some shifting and realigning to the right side that caused some discomfort on the right side that hadn't been there before. But that's all gone. It all resolved itself out, and it's all doing much, much better.
That day I went home, I had no pain. But then, to be honest, the next day the pain came in. About 3 or 4 days worth of pain, and after that 3 or 4 days I had 6 weeks of absolutely no pain. It was the most fabulous experience. I've had pain for 10 years and I have no more pain. Then 3 weeks of pain, which inflammation is good because inflammation means that the stem cells are growing, and since then I've had no pain.
My first experience was with plantar fasciitis, and everybody I had talked to said, oh, that's like a 6-month time, you're going to be out of racing for quite a while. And literally I went in for 30-second shots in my foot that were excruciating, and 3 weeks later I was racing again. So that was my first experience, and definitely was kind of locked in. The shortest was just a couple weeks. The longest, sometimes it takes a couple months because there's rehab, and I think it has a lot to do with when you get in there, how long you wait. We tend to wait too long. I think it varies on the injury, but again, he always lets you know, he's always one step ahead. This is how long it's going to hurt, or this is when it's going to start to feel better, or this is when you can walk, and this is when you can run. So he lays it out for you, so it's kind of a no-brainer. You can just follow directions, and that's why I really trust him.
It might take a couple of days to recover, but what I enjoy is they explain that to you, and they tell you that this is what's going to happen, and most of the time they're absolutely right. Now sometimes it's kind of miraculous. They'll do the procedure, they'll give me the explanation, I'll plan on waking up the next morning hurting and not being able to walk or something, and I'll bounce right out of bed and everything is fine. It's really good. They give you all sides, all angles of the injury and all the possibilities, so there's really no surprise as to whatever happens after their treatment.
So now I'm in physical therapy, but I am amazed at how well it's healing so quickly.
Well, I think the main thing is that just because you have this procedure done doesn't mean you'll get away from physical therapy or exercise. You still need to do a daily exercise routine and stay up with physical therapy and take care of your body. This alone helps, but you got to do your part too.
After the procedure, you can resume your normal activities right away. You will be sore, so I always tell people to not plan something like a family reunion or a trip to Paris the day after you have this done. So for a few days you're sore. We want you to stay active but not exercise. You can get back to work usually within 2 to 3 days unless you do a very heavy manual labor job, or let's say you're like a lineman for an electric company. It wouldn't be safe for you to do that till you were feeling 100%.
We definitely have a time period after the injection where we want you to protect the site that was treated. We want you to move. We think movement is very important, and we use the term motion is the lotion to describe that. Resumption of normal activities can occur after that pain phase is done that we spoke of, or after the first 7 to 10 days. We want you to get back to doing normal activities, and that will include activities that weren't painful before your injection. If you were unable to do an activity without pain before the injection, we don't think you're going to be able to progress to that until the effect of the injection has taken place.
Depending on the target tissue that we're treating again, sometimes we'll limit your activity to protect the tissue so it won't get pinched or rubbed or stretched or torn. So, for example, if we're treating a knee and we're trying to protect your meniscus, we will try to have you not do ballistic loading or really load that joint for several weeks. If we're treating a rotator cuff tendon, for example, we want your elbow to stay close in pulling motions. We don't want you trying to do a lot of overhead motion and flapping your arm. So it really just depends on the target we're going after.
You do need to cut back for about 2 to 3 days. So 2 to 3 days, take it easy, stay active, move. You can relative rest, but don't rest completely. You can increase your activities from that point forward. Really, to get back to full activities, it may take you a month or so to get there, but at 2 weeks, you're back to everything you'd like to do except for heavy plyometric activity.
Depending on the area we treat, we definitely try to get people to cut back. We do know from some of the studies that you need some tissue signaling to be going through the tissue to tell it which way to grow. So there's a fine line between the too muches and the too littles. If you do nothing, the tissue doesn't grow in a nice linear elastic fashion. If you do too much, then you break the tissue down and you destroy the signaling. So we definitely ask people to cut back.
Normal routine, actually different. I was able to go back to my normal routine in about 4 weeks on my elbow. The knee was more severe because it was something I had injured years before and it had time to get worse. It probably took me 2 months on the knee. Actually, the martial arts I was able to do, it was physical conditioning and training, running, anything with impact that I had to be somewhat more patient for.
Outside of riding, I was able to do everything I normally do. I have dogs that I run in dog agility, so running was no problem, regular daily exercise was no problem, bike riding, hiking, those were no problems at all. I was still able to do things around my horses. We just wanted to have the time off so that my knee wasn't tweaked in any kind of way. But outside of that, I was able to do everything within my own pain tolerance.
I would do stuff within 7 to 10 days, at least. I play a lot of golf, and that's probably why I have so many problems. I was playing golf about 150 rounds a year, and I have a small lawn service that I do that I'm active with my hands and knees and everything. But yeah, I get pretty much immediate results after the inflammation period's gone, and then I start getting more active and active.
It took about a week for the pain to kind of settle down, and then I'd say about 3 weeks it just turned a corner, and by that 4th week I was in physical therapy, and it had kind of locked up a little bit with scar tissue, so we're working on that, but I just keep making progress every week, and it's amazing. They said the muscle looks really good and it's healing really well. I can move again, I can take off my jacket, I can put it back on, I can just do daily things that I couldn't do before. I'm out working in the garden, which I didn't do all last summer, so that is fantastic.